Hello friends, I am Dr. Barbie Wasson with Riverpoint Family Acupuncture, and this is Riverpoint's podcast where we get to the point on all things acupuncture, health, and vitality in this beautiful river valley. Today, we are talking about something that is close to my heart and honestly, something that feels increasingly relevant in my own life. We're going to talk about perimenopause, menopause, and the years that come after. And I would like to offer you a different way of thinking about this chapter in life. In Western medicine, menopause is often framed as a loss of hormones, fertility, sleep, mood stability, and bone density. The messaging can feel pretty grim, but in traditional Chinese medicine, we see this very differently. Perimenopause, menopause, and postmenopause aren't a decline. They're a profound energetic transition, a shift in yin and yang, blood and qi, and that shift can be supported, not fought. I like to call this time second spring. Actually, Chinese medicine coined that term. Your body is asking for different nourishment, different rhythms, and different kinds of strength. That's not a bad thing. That's actually an invitation. So let's talk about how Chinese medicine understands what's happening. In broad strokes, Chinese medicine sees menopause as a natural shift in the body's deepest reserves, the energy and fluids that have been fueling your system for decades. Think of it like a river that's changing course. The flow doesn't stop, but it moves differently. And when the body is adjusting to that change, you feel it. Hot flashes, night sweats, poor sleep, anxiety, heart palpitations, that wired but tired feeling, dryness, skin, hair, and joints, digestive changes, shifts in weight, brain fog, mood swings that seem to come out of nowhere. None of these are personal failures. They are signals. Your body communicating that it needs something different. And the beautiful thing about Chinese medicine is that we have language for all of it. And more importantly, tools to respond to it. Now, in my practice, because I don't prescribe hormones or medications, my work focuses on what's squarely in my scope, and there is actually a lot there. Acupuncture is the cornerstone. It calms the nervous system, supports sleep, helps modulate hot flashes, sweating patterns, supports digestion and mood, helps the body adapt to change instead of staying locked in stress response. That last one is actually huge. So many of my patients are white-knuckling their way through this transition with their nervous system in overdrive. Acupuncture helps take the foot off the gas. Beyond needles, I also work with TCM food therapy. This isn't about going on a diet. It's about using warm, digestible, blood-building foods to nourish your yin and blood. We adjust food choice based on whether you're dealing with hot flashes, dryness, or mood swings. And we bring in the idea of seasonal alignment, eating in a way that matches where your body and the seasons actually are. I also talk a lot about nervous system rituals, things like gentle movement, breath work, restorative practices, and honestly, just creating better boundaries around overwork and overstimulation. Your energy budget has changed. What used to be sustainable may not be anymore, and that is okay. We just need to work with it. And for those dealing with skin changes, dryness, texture shifts, the way your face feels different, cosmetic acupuncture is a beautiful option. It's non-toxic, non-injectable path to facial rejuvenation. It also helps you feel at home in a face that's changing, and I find that piece really meaningful. Now, it's worth noting that perimenopause, menopause, and postmenopause are related, but they are not identical. And the support I offer shifts accordingly. Perimenopause can feel like living in two worlds at once. Hormonal swings, cycle changes, sleep and mood variability, all happening at the same time. In this phase, my focus is on stabilizing digestion and nervous system tone, gently cooling without weakening, and keeping blood and yin nourished so that the transition feels a lot smoother. Menopause itself, defined as 12 months without a period, often brings a strange kind of clarity along with the symptoms. Here, we work to reset your baseline. Less volatility, more predictability, routines that support deeper recovery. And post-menopause, this is where the second spring often fully arrives. Once the most dramatic shifts have settled, we shift our work toward bone, joint, and connective tissue support, skin, hair, and sexual health, and mood, cognition, and a sense of purpose. We move from symptom control into building the kind of vitality you actually want for the next few decades. I want to say something directly to anyone who's been told to just deal with it or handed a single prescription with no context or conversation. That is not enough, and you do deserve more than that. My approach is slower and more relational. We map your patterns together, we choose acupuncture points and food strategies that fit your specific picture, and we build something that actually holds. You don't have to navigate this alone. Second Spring is real and it can be vibrant. If you're curious about what support might look like for you, I offer free consultations, no pressure, no obligation, just a conversation. You can find that link on the website at riverpointacu.com or just give us a call. With wishes of wellness, I'm Dr. Barbie Wasson, your acupuncturist who may or may not be taking very detailed notes for personal reasons, reminding you that your body is not failing you, it is asking for something different, and it absolutely is worth listening to.